Rehabilitating back into the workplace. I think this is so important, and it is the one point which I feel is often left out. People are put through treatment and everything's fine now, and they come back to work and then they relapse. And that to me is a big problem. First of all, the most important thing is that the manager needs to be aware that the individual has been successfully through treatment or not, and that so the company doctor or the occupational health professional needs to have a report from the therapist or from the treatment area where the individual was treated in respect of the success of the treatment, and then there needs to be a risk assessment and adjustments in the workplace at first to ensure that they are safe and that colleagues are safe and the public are safe, and then as they progress forward, that the manager is able to supervise them effectively so that they're able to see that they are well adapted now and they can move forward and return to their full normal duties. Relapses do occur, and if the individual knows they can safely come confidentially to occupational health or to the company doctor and say, I've relapsed, that is important. Then the two golden rules come into play. And the two golden rules are: one, if you have been drinking or taking drugs, you don't come into work. The second golden rule is that you must report the problem to the company doctor or occupational health professional or your therapist. Now, method in the madness. The key issue is that you're dealing with denial. There is no denial then, there is open dialogue. And the second point is you can then use that relapse as part of therapy in helping the individual understand the triggers which actually cause the relapse and dealing with those triggers. So it's a very useful process in respect to that. But the first element is the two golden rules must be adhered to. They don't turn up to work intoxicated, otherwise it's a disciplinary issue. And the second is they must accept they have relapsed and talk to the therapist or their occupational health.